The major differences between a mini lift and a traditional facelift or standard facelift is really the surgical technique is different in the way that I address the SMAS layer. The SMAS layer is essentially the muscle layer, or the musculo-aponeurotic layer of the tissues underlying the skin. So the way that I address that layer is what's different between a mini lift and a standard facelift. But from a patient's perspective, what's different is the longevity is different. The standard or traditional facelift is going to last 5 to 10 years, whereas the mini lift lasts about 2 to 5 years. The other difference is the recovery. The downtime is a little bit longer with the standard and traditional facelift. With the standard lift, it's about 2 weeks. With the mini lift, it's anywhere from 5 to 10 days. And finally, the cost difference is significant for some patients. And the mini lift, oftentimes we are able to do it in a ambulatory setting without general anesthesia or twilight anesthesia. So our standard facelift we can do with general anesthesia, or some patients prefer to do twilight anesthesia or conscious sedation so that they don't have to be intubated, and that's something that we've done more often than general anesthesia, actually. And our mini lifts we can actually do in a manner that's less invasive from an anesthetic point of view, and do it with just some oral sedation and local anesthetic. So it's even less involved in terms of anesthetic requirements. So that a lot of patients like that aspect of having a mini lift done.